Hi, I have suffered with capsular contracture on 2 occasions and will probably need to replace my current implants very soon as I'm starting to experience pain. Apart from removing and replacing the implant, are there any other options that I could consider to mitigate the risk of suffering from capsular contracture? Again, I already have the polyurethane implants, but this did not resolve the problem. Right, that's an interesting question, isn't it? Capsular contracture goes through a sequence. It's a progressive condition. It tends to get worse. And it starts off by being able to feel the implant, but you can't see anything. Then as it gradually hardens more, you start to see the implant. It looks like a sort of golf ball, well, not a golf ball, cricket ball. Anyway, big like a ball. Um, so it looks like a ball, looks like a sphere. So you can look like rounded, and then it gets painful, and it normally goes in that sequence. So I'm a bit like thinking, hold on a minute, you're saying you got pain, are they hard as well? So if they're not hard and you just got pain, I'll be thinking, hold on a minute, is this capsular contracture? Particularly since you've got polyurethane implants, because as you said, polyurethane implants got a low rate of capsular contracture. And also polyurethane implants can be a bit uncomfortable. You can feel the edges. They do have a much more of a settling in period. How long have these been in? Doesn't say. It can take a year, maybe even more for polyurethane implants to settle. They can take a while. I have had one patient who I have had to remove the implants because she had pain. It wasn't capsular contracture, she had pain with polyurethane implants. Sample size of 1, I think polyurethane implants are good, but this happened to one patient of mine, and it's a bit of a worry. And yeah, and the other thing that worried me was, what if the pain's not caused by the implants? In that case, I did take the implants out. Pain was solved. So thank goodness, because it would be terrible to take the implants out and the pain not solved. But and I said to her, it's not common for the implants to cause pain, but clearly they can because this patient had it. So it might not be capsular contracture. It might be the implants. It might be the fact that the tissue goes into the implants, and that might be causing the pain and the discomfort. So that's the first thing I'd say. I'd say that it might not be capsular contracture if your presenting complaint is pain. Usually pain is an end stage complaint after the hardness and they feel like rocks really when it gets uncomfortable with the pain. But apart from removing and replacing the implants, are there any other options I can consider to mitigate the risk of suffering capsular contracture? Not really. I'll talk in a minute about some drug that someone mentioned the other day, but it's not really something I know much about, but not really no. How do you stop capsular contracture? I mean, it's a study which said that if you do a lot of horse riding and running and things, that the sort of constant micro trauma can cause a bit of bleeding around the implants and might accelerate capsular contracture. But I'm not going to start telling people not to do horse riding and not to go running. It's sort of anecdotal evidence in that it's not causative, but it's just some people who got capsular contracture, they look back and think, oh, these are runners and horse riders. And there's a bit of blood around the implant when they went back to do the capsulectomy. So but if you've got capsular contracture, apart from removing and replacing them, what else could you do? No, I don't know of anything actually on this one. But I would say that if you do replace them, and especially if you've had them on 2 occasions, I would really worry that you're going to get it again. So I would think, goodness me, do you want to go through this again? So first of all, my first advice is leave them as long as you can. And my second thing is, do you want another set of implants? Because if you've had it on 2, if it is capsular contracture, you've had it twice now, every time you do surgery, you create more scar tissue. So you've got a higher risk of capsular contracture every time. So you've got it's a vicious circle. It's horrible. And if they didn't have polyurethane, I'd say go polyurethane. But if you've got polyurethane already, I think, oh God, consider whether to have implants at all. The other thing is, if it's not capsular contracture and if it's just pain, it might be the polyurethane implants. It might be causing the pain. Like this patient, in this case, I removed the implants and she was pain free. But then obviously you don't have implants, so. But whether it would happen with a different type of implants, I don't know. It's a one that you need to talk to. That's a proper consultation one. That one, difficult one. But the question for the viewers: is there another way of reducing the chance of capsular contracture? There's lots of things we do to reduce the chance of capsular contracture, but from your point of view, not really. Just stay healthy, be positive, and put up with it for as long as you can, because it's going to come quicker second time around. But there's not a lot you can do as a patient, as I say about the horse riding and running. But I don't really think that's spray tans as well. Spray tans prior to having surgery. It's too late for you because you had surgery, but it's one of the things we don't ask people to do, spray tan before the surgery, because there might be little bugs in the spray, and it could subacute infection, so not proper full-blown infection, but little mild infections can cause capsular contracture. So that's why we ask not to spray tan before surgery and things. Anyway, yeah.